So this is going to be a brief series of educational videos describing a sort of overarching concepts of what's involved with having a patient that presents with chest pain, and very specifically how we risk stratify these patients. While we always talk about risk stratification, in the common vernacular, all we're really concerned about is that when we send the patient home, they don't die. And so that's how we're going to start out as we start to examine how to evaluate a patient that presents with chest pain, especially chest pain that's suspicious for cardiac. So in this case, we have a 55-year-old female. She has 2 to 3 days duration of mild intermittent chest pain. The pain is radiating down her right arm, but not her left arm. No nausea and vomiting, and the pain is not related to exertion. Patient has a history of hypertension. She quit smoking 4 years ago, and as far as family history goes, she is adopted. So this is where we're going to start. So we're going to briefly go over the 3 goals of these videos and the methods by which we're going to obtain those goals. All right, so goal number 1, goal number 2, and goal number 3. The first goal that we mentioned earlier is probably one of the most important, which is to make sure that the patient does not die from any sort of myocardial event, or in layman's terms, from a heart attack, when we send the patient home. The second goal that's important is you should respect but not fear cardiac chest pain. I can't stress that enough, that some people are afraid of it, which is never a good idea. But at no point should you ever not respect cardiac chest pain. So the big point is to respect it, but not fear it. And what you'll find out is the more you learn, the more you respect it, and the less you fear it. And the third goal that we should have is, I'd like you to think about how you can improve this process where you work at. So this is just a broad overview, but keep in mind that while the concepts and the principles are the same, right, there's always ways to improve patient care in the very specific environment in which you work. So how are we going to accomplish these 3 goals? Well, we're going to use 3 methods. So we're going to use 3 methods. So the first method is we're going to be using a layered approach to learning. So as you learn, it's always best to understand the basics, and then what you do is you layer another layer on top of that, and on top of that, and on top of that. If you try to learn all of these at once, one after the other, what you'll find is you've a hard time understanding the basic overarching concepts. So in this case, we're going to apply the 80-20 rule, or sometimes the 90-10 rule, which says that 80% of what we need to learn, truly need to learn, is actually only 20% of the material. So what this 80-20 rule says is that if you know just 20% of the material, you'll be able to take great care of patients 80% of the time. So there's no reason to memorize everything. You just need to know the important 20%, and you'll be able to take care of 80% of the patients that come up. The important point is that if you've got a patient that falls outside of this rule, that's a good time to open up to date and take a look. Or ask for help, which is always a good idea. The second method we're going to use is we're going to answer any questions that you might have in the comments below. So if you have any questions, ask them and I'll be happy to answer them. If they're going to be covered in an upcoming video in a short period of time, I'll point that out as well. And finally, as we move along, we're going to discuss various clinical cases that will improve your confidence as your workups and clinical reasoning becomes more structured. And we'll go back to the first case, and then we'll do a few other cases along the way. After, we'll give you a broad overview, and then after we dive down into each of those important areas that you need to understand. And the next video will be about a sort of overarching structure that allows you to evaluate patients with chest pain, especially cardiac chest pain, that will allow you to send them home safely. And I hope you enjoy it. This will be coming up in a few moments.